Life with a chronic lung condition isn't always easy, but thanks to home respiratory services, patients can be treated in the comfort of their own homes. Home oxygen therapy is available for patients with chronic lung conditions like COPD and obstructive sleep apnea.
Fundamentally, every Ontarian has the privilege and the right to select the home care provider that best suits their needs for service, equipment, and ongoing 24/7 care.
In Ontario, the premier providers of home respiratory services are all members of the Ontario Home Respiratory Services Association, the OHRSA. They abide to a high standard of care and services to their clients.
Essentially, ORSA members provide the interface between a hospital or a referring physician and the patient in their home. There's two services that ORSA fundamentally provides. One is portable oxygen therapy or home oxygen therapy. The second being continuous positive airway pressure or CPAP therapy for the treatment of obstructive sleep apnea.
When it comes to home respiratory services, choosing the right provider is crucial.
There's a high standard of care, and to be an ORSA member, not only do you comply with the Ministry of Health's regulatory guidelines and protocol, but ORSA has a higher standard code of conduct that directs our members' behavior.
The patients are the number one thing. I mean, it's great. And it's fantastic. We have funding, we have programs through the government, through private insurance agencies, those kind of things. But the patients are what we need to be there for. And generally, ORSA members are there for our patients. That's why we're members of ORSA, because we want to provide a higher standard of care.
Home oxygen therapy goes well beyond the supply of oxygen. OHRSA encourages people to research the service providers in their communities, find out the expertise of their staff, ask about the equipment they offer and the services available to determine the best fit for their situation.
A new patient starts out on oxygen. We will go from what the hospital has told us their requirements and their needs are as a baseline, and then the respiratory therapists will go out to their home. They will assess what their needs are in the home, perhaps the layout of their house, so how the equipment is best going to suit them. Are they a traveler? What kind of equipment? There's the equipment aspect, and then there's the needs. So we will monitor their oxygen levels at rest. We'll walk them around their house, see if they're going to need a different setting on exertion. We'll have a follow-up plan. We'll communicate to their physicians and other healthcare workers so they know, and then we have ongoing care that we go back regularly, we follow up with them, and then we always tell the patients that if something changes, so you feel great now and in a week or 2 weeks something's not right, call us, don't make a change, and we come out and we'll reassess you. Patients like the relationship. I practice in a small town. A lot of it's rural, and a lot of our patients know our staff or know their family, and so our patients that I see, they like the connection that they've made with their respiratory therapists and their nurses that come in and care for them. And the other thing that we hear is patients are just happy overall to be able to breathe.
To learn more about home oxygen therapy or service providers that are approved by the Ministry of Health, please visit ohrsa.ca/members.